Welcome to Adapting Class. This is video 2, series 2 on the nutrition concept that I'm talking about. It deals with fundamental GI and risk reduction. These are big areas of your NCLEX. Stick around, let's learn some concept. These are key facts you have to know when it comes to NCLEX regarding nutrition. The specific things I want to highlight. The first one is this question. As usual, always go for the content from the back. Which of the following findings indicate that the treatment is effective? Select all that apply. What treatment? A client with severe malnutrition is receiving hyperalimentation. I decided to use some of the big words that they will use that will confuse you. Don't worry about it. Sit back or listen. Think about it. First thing, treatment is effective. That means it's working. That's the buzzword. Second one, severe malnutrition. That means the individual is malnourished. Three, another buzzword, receiving hyperalimentation. That means you feeding them. What kind of feed? Most of the time, hyperalimentation is TPN. So they're getting some form of nutrition, whether orally or parenterally or through what? Total parenterally. That means TPN. It does not matter. Patient is receiving some form of what? Nutrition. Which of these tell you the patient is doing well and the treatment is effective? If the client report increase in appetite, think about it. When your appetite goes up, does that relate to your nutritional status? No. You can be eating some hamburgers and eating some chips and still it doesn't relate to what? Your nutritional status. White blood cells count is elevated. Those are trapped. I put the elevation there. You think, oh, that shows that the patient is responding. But guess what? If you're on TPN and your white count is elevated, this is infection, complication of TPN. Prealbumin level has increased. Even if you don't know what it is, divide it into two and you can see there's something there. There's something prealbumin. Forget about it. Take this off and focus on it. Albumin represents your protein status. So it tells you how much protein. So if albumin level has increased, that means my protein level has increased. That's a good one. The client blood glucose is elevated. Another trap. You think you're eating, so your glucose goes up. Patient is receiving hyperalimentation. I expect the glucose to go up. And if it's too high, that is a complication related to the TPN. Increase energy and activity. Yes, when your protein and everything increase, you start to have some energy and do the things you're supposed to do. And those are signs and symptoms of resolving of your malnutrition. So those are the two. But this is a selected apply for the NCLEX. If you know only one, pick it and move away because there's a bunch of traps there that you pick and you lose more points. So those are the two answers that you should focus on. And this is providing district teaching to a client with newly placed ileostomy. Which of the following client statement indicate that the teaching has been effective? Select apply. What do you know about ileostomy? The output is all liquid. It causes dehydration. So patients need to be educated about ensuring they're taking adequate fluid intake and preventing food that will cause blockage. You see, I have my buzzwords, I have my case, I've come out with my content. I know what I'm looking for without looking at the answer. I talk to myself. I said, these are the things about ileostomy. I will empty my pouch when it is about 1/2 full so that it doesn't get too much full and pull away. If you wait until it's completely full, it will leak. So this is good. I need to drink plenty of water to avoid what? Dehydration. I told you dehydration is the number one. I can expect my stool to be solid and well formed. A well formed stool that is solid will not lead to dehydration. You see how content matters. Therefore, B and C are contradicting each other. Therefore, don't pick this one. I will check the stomach regularly to make sure it is stay pink and moist. A pink stomach is good. A black blue stomach, bad thing. Those are the content I'm pointing out. If I have a lot of watery output, I should contact my air care provider. I'm worried about dehydration. Call me when you have too much fluid and we can thicken it up. I will add food like popcorn and nuts at first to prevent too much liquid bowel movement. It's a trap. The half of the question answer choice is right, but those popcorn and nuts is going to cause obstruction, and therefore you should avoid them. So those are not the things you should teach the patient. So A, B, D, E are the right answer. Stop the video, answer it, listen to me, and then you can see how I approach it. Which of the following action by the nurse is inappropriate? Wrong thing. A nurse is planning care for a client with a new order to initiate total parenteral nutrition (TPN) that contain 10% dextrose. A bunch of words, irrelevant. Go for the buzzword. Patient is receiving TPN. Which of the following action by the nurse is inappropriate? Okay. Where do TPN go? Central line. It can be PIC line, which is peripheral insected central line, right? The same thing. Use of pump. Yeah, you got to set the rate so that it can give you slowly. Infusion pump to administer. That's good. Monitor the blood glucose every 24 hours. Their sugar is going to go up. One of the biggest things is hyperglycemia and hypoglycemia. Therefore, 24-hour check of glucose is bad. Change the TPN tubing and a filter every 24 hours. You can't use it more than 24 hours. So the bad, inappropriate action is checking glucose every 24 hours. Which of the following client statement indicate need for further teaching? Buzzword, need for further teaching. They're doing something wrong. They're saying something wrong. They're thinking something wrong. And then she's teaching a client with right-sided heart failure about dietary therapy. Before you look at the answer choice, you say, oh, right-sided heart failure. Oh, he has a heart failure. What should you avoid? Too much fluid. What causes fluid retention is your answer. And things they need to do to prevent too much fluid, weighing themselves, avoiding certain food. Now I look at the answer. I will limit my sodium intake to reduce what? Fluid retention. That's the key word. I can eat canned food and soup as long as I eat it up myself. Look, canned soup is full of what? Sodium, and that will cause water retention. Avoid it. If I will weigh myself every day to check for fluid buildup. Yes, do that. I will try to avoid processed meat like bacon and ham. They all have what? Salt. Therefore, B is the right answer. NS is caring for a client who has what? Abdominal surgery yesterday and was started on clear liquid diet today. Which diet choice by the client are appropriate? Select or apply. This is GI teaching, intervention, risk reduction. They're picking something wrong, you will intervene because they are now on clear liquid diet. What is clear liquid diet? Anything you can see through. Look at the answer choice and ask yourself. You don't have to memorize what constitutes clear, full, and regular. If I can see through, that is the key concept about clear liquid. If I cannot see through, that is the concept about full liquid. Therefore, apple juice, hey, I can see myself through. Chicken broth, I can see myself through. Lemon gelatin, it melts, it becomes yellow. I can see myself through. You can see yourself through milk. Orange juice, no, because of the pulp, you can see yourself through. Vanilla, too thick, you can see yourself through. Cranberry juice, it look light, but it's still dark. You can see yourself through. These are all full liquid diet. Master those content. You will never go wrong. Which of the following actions by the student indicate an understanding of the correct technique? That means they're doing something. We want to make sure the technique is appropriate. And next, what is the buzzword? And next is observing a student pursue what? And next, preparing to administer tube feed to a client via percutaneous endoscopic gastrostomy tube. Which action is indicate correct understanding of the technique? Don't worry. PEG tube is the same thing as what? G tube is the same thing as gastrostomy. That's all. That means they're getting feeding tube to the stomach on the skin. What do you do? Do you lay the patient flat in bed to promote digestion that will cause aspiration? Nobody eat in the flat position. Verify tube placement by injecting air or auscultating the stomach. We don't use air anymore because it's what false. It give you false positive, right? False negative, both either way. But the best thing to do is to check a gastric pH. That will tell you you are in the stomach. Flush the PEG tube with what? 30 ml of water before and after. That's a good thing. 30. Administer the feeding through a 10 ml syringe. It's too small. You use, when you're feeding somebody, use 30 or to 60 syringe for infusion of the fluid. So that one, C. Which diet-related teaching should the nurse include in the client plan of care? Select or apply. A nurse practicing in an outpatient clinic is caring for a client recently diagnosed with what? Hyperthyroidism. Look at the way I'm going to tackle this question. I have hyperthyroidism. That means everything is up. My metabolic rate is up. Therefore, whatever I eat, I'm going to consume it. And therefore, if I don't eat appropriately, I'm going to lose weight. That's why their weight is down. So what do you tell them? Choose high calorie snacks between meals so that you can get some energy. Increase fluid intake for your metabolism, 2 to 3 liters. Avoid food and drinks high in caffeine. Caffeine increases your heart rate. Hyperthyroidism increases your heart rate. So you should avoid it. It's good. Follow a low protein diet. That defeats the purpose of choice one. You should not do that. You need a lot of protein. Increase iodine rich food like shellfish and seaweed. Hyperthyroidism means you have too much thyroid hormone. If you give them iodine rich food, they will make too much thyroid hormone. That will increase their metabolic rate. And so that is bad. Those are the right answer. A little bit test taking strategy and a little bit hard, but that is the purpose of adapting NCLEX questions. Which of the following diet choice is appropriate for this client? Think about it. Which client? And next is caring for a client with acute pancreatitis. The pancreas secretes lipase and amylase for what? Fat digestion. If the pancreas is injured, what would you do? Don't give them fat. That is the concept. Key. You see, every question that I answer, I go for the concept. And I use the concept, a back of concept, and I look at the question. Sausage, too much fat. Egg, well, yes, some protein. Buttered toast, too much fat. I ignore it. Gray salmon, a little bit of fat in it, omega fatty acid in it. Even though it's good in the brown rice and salad, it's okay, but there's still some fat there, right? Apple sauce, excellent. White toast, no fat. Clear apple juice, excellent. Cheeseburger, no, I'm staying away. And French fries, away from it. You see how you can answer these questions. Which item is most important for the nurse to keep at the bedside? That means all of this is very important, but which one is the most important? Therefore, make sure the answer choice fits what the question is asking. A nurse is caring for a client receiving what? TPM via central line. If you have to pick one thing, what would you pick? Oxygen, max, and suction setup, bedside common, 10% dextrose in water, incentive spirometer. Of course, we need incentive spirometer. Of course, we need bedside common. Of course, we need oxygen max. But when you stop the TPN, there's a risk of hypoglycemia. So every time somebody is getting TPN, they need D10 available. As soon as we stop it, we hang the D10 to keep them their sugar normal. So don't forget that concept. The last one, a nurse is teaching a client with type 2 diabetes about appropriate dietary choices. Which of the following meal choices indicate the client understand diabetic meal planning? A bunch of words. Don't worry. The key word is diabetic meal planning. Which one of them? Which one? Go to the content. Patient is diabetic. That means there should be no too much sugar. Don't pick too sugar. That is the key for this question. No fat, but key sugar. Fried chicken, white rice, and sweet tea. Too much sugar. Grey salmon has some fat in it, but not too sugar. Quinoa and steamed broccoli. Excellent. Low glycemic diet. Pepperoni pizza, too much. And regular soda, pancake and syrup, orange juice, too much sugar. Therefore, these are your right answer. Thank you for watching. Good luck in your exams and keep charging as always. Never stop charging. Best of luck. Bye.